For as long as there have been babies born into this world, mankind has wondered about how life begins and develops in the womb. Now, with the advent of new technologies like real-time ultrasound imaging, we can see in exquisite detail how an unborn child is formed. Ultrasound utilizes high-frequency sound waves and is a safe procedure for both the mother and the unborn child. The sound waves are transmitted into the mother and are reflected back through a transducer. A computer will then tape these electrical pulses and convert them into an image, which we can recognize as the unborn child. Sherry Richard is a registered ultrasound technologist who has the opportunity of watching the unborn in the privacy of the womb and has experienced firsthand the many wonders and benefits of this exciting technology.
Will ultrasound have any effect on the baby at all?
No, not at all. In fact, we've been doing tests for 20 years, and they haven't been able to find any biological effects at the diagnostic exposures we use. So you don't have to worry. Anyways, I'm going to get started now. I'm going to put some cold gel on you. There you go. That's going to help transmit the sound. Does that tickle?
It's cold.
Okay. This is your bladder, and this is your baby right here. He's jumping for you. Look at him.
Wow, I can't believe how developed he is. Look at him move.
Yeah, he's been well developed since 8 weeks. He's had all his parts. Look at him. Oh, look at you.
How come I can't feel that?
You won't until the 4th month, but he's been moving in there since 8 weeks. He's got a whole lot of room in the womb to move, and with all that fluid, they're able to move around, do somersaults. You know, look at him. Do you believe it? You're going to have your hands full, girl. Look at that.
Ultrasound has also been a superb tool for teaching us about our prenatal development stages. The images you're about to see will reveal in all its wonder and mystery the beautiful continuity of the unborn, the growth and development of a human embryo and fetus from 3 to 4 weeks after conception to just before birth. The birth of a human life occurs at the moment of conception, when the mother's egg or ovum is fertilized by one of the father's sperm. During this act of conception, the two cells become a single living cell, a unique individual who never existed before in history and will never be duplicated again. At 4 to 5 weeks from conception, the embryo measures only 1/4 of an inch, about the size of an apple seed. Its heart begins to beat on about day 18.
This is an image of just 4 weeks. Can you see the heart beating? Listen to the Doppler of that heart. This embryo is 5 weeks. You can clearly see the formation of the head and body.
As the embryo reaches the 2nd month, it will measure approximately 1/3 of an inch. The dark circles of the eyes are the retina and can be clearly seen. The beginning stumps of the arms and legs are beginning to grow. The embryo floats freely in the amniotic fluid, which will cushion and protect the baby for the 9 months he will spend in his mother's womb.
Now this is a 7-week baby. I'm going to magnify this image, and now you can clearly identify the arms and the legs and the head. Watch him. Watch me as he moves. This is another 7-week baby. Here's the uterus, gestational sac, and the baby. Again, watch as he moves within the sac. 7 weeks is the time that we first visualize movement. Here's the yolk sac, which will supply the nutrition for the baby until the placenta can take over.
At 9 to 10 weeks, the fetus is 2.5 inches long and floats in the amniotic sac, which by now has filled the whole uterus. Vigorous activity can be seen as the baby kicks, jumps, turns somersaults, grasps with fingers, opens his mouth and sucks his thumb.
This is a 10-week baby, and he's now able to move vigorously within the womb. There he jumps, just waved at you. Now he's going to do a jump for you. There he goes. He's able to utilize the whole uterine cavity now because he's got all this space to move. Here he's going to get ready for another jump. There he goes. Now he's turning and looking at us. You can see his eyes. Here he does a few more jumps. The mother, he would not hold still for 30 minutes, and his mother was really impressed to see what he could do. Now we have 10 weeks fraternal twins. The baby on the left is seen moving and jumping around, while the twin on the right is just hanging out, sucking his thumb. They develop those habits in utero. And now what I'm going to do is image the full axis of the twin on the right. Mom and Dad were shocked, yet delighted at the news of their extra bonus.
By the end of the first trimester, the baby measures only 2.5 inches and weighs about 1 ounce. There is still a lot of room in the womb, and the baby is busy utilizing his private playground. He resembles an astronaut as he floats and jumps around.
See the detail of the face? You can see the eyes and the mouth. This baby's going to open his mouth for you. Watch him. Now watch, he's going to scratch his chin for you. Watch him.
In the 4th month, the baby will grow to be half as tall as its birth height, about 12 inches. The baby has begun to crowd its living quarters. The skin is so transparent that the branching blood vessels can be clearly seen. Because of the increase in size and strength in the baby's movement, the mother will begin to show and feel the first stirrings of life within her. Fine hair has begun to grow, and sex organs are now apparent.
Now this baby's 14 weeks old, and he's going to try to stand on his head in a minute. This is his head and his back. Now watch him as he climbs that uterine wall. Can you see? Look at that back arch. See how limber they are? They can do more in utero than a newborn baby can do outside of the womb because of the amniotic fluid present. Look at, he struggles to stand on his head there. In the 2nd trimester, all the organs can be easily identified. Here's the heart beating, and here's the stomach. The baby swallows the amniotic fluid. Over here is the kidney that can be clearly seen, and the baby urinates in utero now. Over here is the diaphragm. As the diaphragm moves up and down, the baby is breathing. And again, look at the heart. You can see the separate chambers of the heart and identifying the different valves. Listen to the Doppler of that heart. Here's a color image of the blood flow through the heart. This is a hand. He's making a little fist at you right now. You see the 5 fingers? And this is another hand, and he's pointing his index finger up. You see that? This is a picture of a leg and a foot. And this is a boy. We call that the turtle sign. And this is a girl.
During the last 3 months, the baby's weight will triple to more than 7 pounds and grow to 20 inches. The living quarters become very cramped. Approximately 1 week before the 40th week, the infant stops growing and drops his head down into the mother's pelvis. And now the mother and child just wait for the big day.
This is a picture of the baby's face. You can see the eyes, the nose right there. Watch him as he yawns for you. There he goes. You can see his eyes. Now this baby, you can see his hand rubbing his face. See the eyes and the nose. Now watch his hand. He's going to do a reflex action for you in a second here. There he goes. Okay, now this baby is going to open his jaw for you. Watch him. You see his chin? Now this baby's going to yawn for you in a minute. He's getting ready to take a nap. Isn't that cute? Okay, now this baby's going to stick out his tongue. There he goes. He's going to do it again. He's just licking his chops. Watch him. There. Well, what do you think of those babies? What do you say to that, babies? Thumbs up. Okay.
ultrasound truly is a window on the womb, through which we can view a human being in its earliest stages of development, and immeasurably deepen our understanding of the miracle we call life.
I have a special attachment for these babies as I watch them in the womb develop and grow. And you know, it seems our society has a way of denying the existence of anything we can't see, feel, and hear. And I believe if a window was placed upon the abdomen of every pregnant woman and the world could see what I view every day, that there really would not be an abortion issue and the unborn would be recognized for its constitutional rights. Our society has adopted a free choice mentality based on the quality of life ethic. Doctors who were trained to provide health and healing for their patients are now put into a position of moral compromise and are now asked to destroy human life. They say that women have the right to choose what they do with their own body. Well, you know what I say to you pro-choicers? Then don't they also have the right to be informed in order to make that choice? Do you know that abortion is the #1 surgical procedure performed in our country and is the only surgical procedure where the physician doesn't have to divulge any of the information necessary for that woman to make her decision? Information of the physiological development of her baby. They refer to the baby as the unborn as a product of conception, a glob of tissue, anything to dehumanize that baby. And I have had many women come to me considering abortion, and I have been personally told to turn the monitor away from women considering abortion, so that seeing her unborn baby moving and jumping around does not influence her choice. And I didn't comply with that, feeling that a woman has to see that in order to help her make her choice. And many women have decided to keep their babies after viewing the ultrasound. They don't tell you of the complications of that abortion procedure. And it's not uncommon for me to see placenta, retained products of placenta, infection, bleeding. There's an increased rate of sterility in women that have had abortions. Ectopic pregnancies, those are pregnancies that are implanted in the tube. Premature births due to cervical lacerations when the cervix has been literally stretched and doesn't go back to normal position. So when the mother carries her baby in the 2nd trimester, the cervix is unable to hold her baby, and she literally delivers the baby early. And they don't tell you about the alternatives for abortion. There's 1.5 million babies being aborted per year. And there's women out there that are trying to adopt that cannot find a baby. I have a girlfriend that has been trying to adopt a baby for 5 years. She couldn't find one. She went to have an ultrasound done for her ovaries for fertility. Right across the curtain, there was another girl having an ultrasound for gestational age. She was pregnant. And the ultrasound technician was describing the baby parts, the arms and the legs, and she said, "Shut up and turn that monitor, because I don't want this baby. I want an abortion." And Rose would have given anything to have had her baby. And she walked out crying. And it's just not fair when we're destroying 1.5 million babies in the womb per year, and women that want babies cannot find one to adopt. Many people are unaware that abortion is legal up till term. What the Supreme Court stated was 1st trimester, there would be no legal restrictions. 2nd trimester, it would have to be done in a safe clinical environment. 3rd trimester, if the mother's life was in danger, that was reason to have an abortion. And health was described as emotional, physical, and AIDS. So if this pregnancy is causing you emotional distress, that is reason enough to have an abortion. And there's doctors out there that will do it if you have the money. These are the facts that the women are not being told. And I believe if women knew these facts, there would not be an abortion decision. What about the women that are finding these facts after they've had the abortion? Many are finding out and are suffering from severe depression, guilt, and nightmares of the decision they made without being informed. Who's taking care of that emotional distress that she's having? I know that feeling, because I've had 2 abortions. And I was told it was a glob of tissue, there would be no complications in future pregnancies, and no complications in the abortion procedure itself. I suffered from severe infection and bleeding and fever from retained products of conception, baby parts left behind. And there was later on, I was told after my 2nd abortion, there was a high chance that I could not conceive again. I tried for 5 years to conceive after I met my husband, and I always wondered if possibly I had aborted the only 2 babies that I'd ever give birth to. And it wasn't until I went into ultrasound school, and I literally saw an 8-week baby jump on the screen, and I knew that I had destroyed 2 human lives. And that's when the guilt set in for me. That is when the truth literally hit me between the eyes. And I suffered from that guilt, depression for many years. And it wasn't until I forgave myself, and I literally asked my babies to forgive me, and I asked my God to forgive me, that that guilt was removed. And I conceived the first of my 3 children that month. And I cannot bring back my babies, but maybe I can help other women so that when they make their decision, they're prepared and they won't have to go through what I went through. And it's the only surgical procedure where a minor can have an abortion, and the doctor doesn't have to inform, or the mother doesn't have to get the consent from her mother or from the father. Something's wrong. Pro-choice, let's give them the facts. Let's lay your cards out on the table so women are informed so that they can make a choice. I have 2 women, Carla and Cheryl, that saw their ultrasound and was considering abortion but changed their minds. And I'm going to let them tell their story.
When I first met Sherry, I was 9 weeks pregnant. And as you can see now, I'm ready any day now. When I went to Sherry, I was seriously contemplating having an abortion. I was in what you would call a crisis pregnancy because my boyfriend had abandoned me, and I was left to face this alone. I felt like a failure to my parents because, you know, how could I get pregnant? You know, I was in college and everything, you know, how could this happen to me? Well, when I seen Sherry, she scanned me, and at that time I was 9 weeks pregnant. What I seen on the screen was amazing. I seen that the baby was fully developed. It had all of his fingers and toes and arms and legs. It was just a matter of, after I seen it, I was wondering how on earth could I have ever thought about killing my baby? This amazing little life that was inside of me. Through Sherry, I have met a lot of people that were able to help me. I was faced with not knowing how I was going to be able to provide for my baby, being a burden on my family because I had to go back home. Through the Crisis Pregnancy Center, they have helped me financially, mentally, and spiritually. They have helped me with clothes for myself as well as for the baby. They have helped me be able to maintain my home and not be evicted, and just there to talk anytime I need it. I just really thank God for Sherry and ultrasounds, and that there are alternatives for not to have an abortion if you become pregnant, and you do not have to be alone. There is help.
So how has your life changed now since you have your baby?
It's wonderful now. He's a joy. He gives my life a new meaning and purpose because not only is it myself now, it's him. And he's my life.
So now that you've had your baby, you don't regret not having the abortion?
No, no way. I wouldn't have this. Oh my God, Ryan.
Cheryl, let's go back to when you were 17, and it was the first time you found out you were pregnant. What was the first thing that came into your mind when you found out it was a positive?
I was afraid, scared, and being so young, I didn't know what I was going to do. Still in high school. At first, I was going to keep it, I remember. But I think just by saying that made me believe it. But everybody around me kept telling me, you know, you're not ever going to be able to take care of this baby. You're too young. You're going to have to go on welfare. You're going to be living in the streets. So it scared me away from having the baby. So I had an abortion.
So you went to a clinic?
Yes.
And what kind of information did they give you there?
Nothing.
They didn't offer you information on adoption?
No.
Did they at all question your desire to have an abortion?
No.
Did they explain fetal development or anything to
Nothing.
you?
Because if I would have known that, you know, I probably wouldn't have done it. No, I didn't know anything. And being so young makes it worse. You know?
Are you experiencing post-abortion syndrome at all?
I was depressed most of the time. I didn't really care about nobody. I was drinking a lot, staying out late, trying to forget it. But I'd come home and wake up and feel the same way, or I'd wake up in the middle of the night with nightmares. I could see it.
What kind of nightmares did you have?
Just having nightmares of blood, tissue, pieces.
Pieces of babies or?
Pieces of babies.
What would you say to a woman if you knew she was watching us, who maybe is pregnant and considering abortion, having gone through it several times? What advice would you give her?
Tell her to look at the ultrasound, see what she's really got inside. There's something in there. It's not a nothing. It's got fingers and feet. It's a baby.
That's what I'm talking about. That guilt is so bad. I went through that. And that's what really makes me angry, is the women, even the fathers that are finding out afterwards. What are we going to do with all these people that are finding out the truth now? They're literally in depression. It's not uncommon for me to do ultrasound on women and after their second pregnancy, after they've aborted 2 or 3, and see the ultrasound like I did, and literally go into shock. I think our world is going to go in shock when they literally find out what's been going on in our nation legally. Whether or not you ever have to make an abortion decision, you're going to have to decide where you stand on this issue. Are these babies alive? Are they human?
At that very instant, I was given life. I was formed in my mother's body. My bones grew as I took form in my mother's body. When I was put together there, it wasn't too long until my heart started to beat. I was made in an amazing and wonderful way. Before you had a name, or opened up your eyes, or anyone could recognize your face. You were being formed, so delicate in size, secluded in your safe and hidden place, with your little tiny child.